Good day, and welcome to another episode of Living Well with Adena, a special town hall for the communities that we serve surrounding the COVID-19 update. We're glad that you've taken a little bit of time out of your day to join us. I have with us special guest today. My name is Dr. Kataka, and I serve as your moderator for this episode today. We do want to hear from you, and our guests would love to answer your specific questions. So if you do have questions or comments, please enter them into the box below. We do have staff that are on standby to be able to get those questions to us. Allow me now, please, to introduce our guests. With us today is Jeff Graham, who serves as President and CEO of Adena Health System. Welcome, Jeff. Along with Jeff, we have Dr. Kirk Tucker, who's an internal medicine physician and also the Chief Clinical Officer for our health system.
Hello, everybody. Thanks, Dr. Kataka.
Absolutely. Last but not least, we have Kathy Edrington, who serves as our Chief Operating Officer. Welcome, Kathy.
Thank you. Thanks for having me today.
Absolutely. We'll start off with you, Jeff. Adena Health System has been through a rough year. Matter of fact, it's been a rough year for everyone. 2020 certainly is an understatement, and I think most of us look forward to 2021. We've been through Thanksgiving, Christmas, and the holidays. Jeff, tell us how the health system has done and managed through this time period.
Yeah, sure. So first of all, I think we've done great. To your point, it's been a journey that started almost a year ago, and I've said many times before, I'm very proud of all the caregivers, the providers, physicians at Adena Health System across our Southern Ohio region, and how they've day in and day out they know the task at hand. And their focus has been laser sharp, and the enthusiasm, the engagement. Are we tired? Yeah, we're tired, but you never know when you talk to folks because they know what we're here to do, and we're called to serve our communities, and they're going to stay with this thing, and we're going to get through it. What I would say about Adena, as we come into 21, is we have a vaccine out there, and the vaccine is the other tool, or if you will, weapon in our belt to take care and get to the other side of this journey that we've been on with COVID-19. And so the big challenges that we have right now across the country is how the vaccination is distributed. And, I would just say the thing that I know that I'm focused on, Dr. Tucker, and working with the governor's office and OHA is, what's the distribution going to be, because we need to get the vaccinations out there. And, we are, we're already looking through the processes and possibilities of how we play a role in that, so that when the direction is given, we're there to help and be a part of the solution to get it done. So there's a lot of work and focus right now on across the state of Ohio on how we get the vaccination out there and rolling the vaccination out. So I'm excited about that. I think we have a promising 21, and we're going to get to the other side of this. And just for the viewers to know that Adena is working nationally, but also with our state, and continuing to find solutions on getting it out there to people so they can get vaccinated.
Jeff, some of our readers or viewers might not know your critical role actually in the region and representing healthcare. I know that you've had some meetings directly with the governor of our state. Can you give the community a little flavor about where the governor's at and some of your interaction with him, and what has been the approach from a state or regional level to fight this continuing pandemic?
Yeah, I think the governor's made it very clear on the media that he wants the vaccination out there, and he wants to get it out there as quickly as we can. And there's just been a lot of unknowns on the flow of the vaccination. And one of the privileges I have is I've been being elected to the Ohio Hospital Association Board, and we work very closely with the state government and trying to provide input and solutions on how we can help in that distribution. But the governor's focus is, looking at, the best processes out there to, as he says, get shots in the arm. And I will comment, just for those out there listening, those vaccinations are not having the reactions. I know here at Adena, vaccinating our healthcare workers. We've not seen any major reactions, and it's proving to be what they said it would be, and that's safe. And we're seeing that here with our own population. But the governor's focus is about trying to get the shots in the arm, and Adena's focus is being any part of that solution we can. And we really believe that Adena and the counties we serve will be a part of that solution. And more to come, probably in real time, in days, not weeks, as the community starts hearing more on how this will roll out.
I heard you often speak as the leader of our health system that one of your key core tenets is partnerships. Can you tell us a little bit about even some of your communications with the top leadership of Holzer or Southern Ohio Medical Center in getting shots into the arms?
Yeah, so we have for quite some time since the pandemic, we started an incident command regionally. We're responsible for Region 7, which is the hospitals in Southern Ohio. So you have, as you mentioned, Holzer Health in the southeast part of Ohio. You've got Southern Ohio Medical Center in the southern part of Ohio. You've got Fayette Memorial Hospital out west. And all of those hospitals, we come together and we have an incident command. Well, now we're not only doing the incident command, now we're having conversations and saying, okay, with the vaccination coming in, how can we streamline our processes, bring all the minds together and looking how we're doing distribution internally. But what if we are called upon, which we believe we will, and we hope we are, because that's what we're trained to do, is how do we put our processes together to be able to go out and take care of the community? And so that leadership has been working well for over the past year. And so that's what we're doing right now in real time. We're actually looking at what would be the best way for distribution and how can we offer that up to support the governor and his actions in trying to get shots in the arm. Is that what you were asking?
Absolutely. So let's talk a little bit more, Dr. Tucker, about shots in the arm here. Adena Health System has received the Moderna vaccine. How is the distribution for those vaccinations going at Adena?
Pretty well so far. We are into our third week of our vaccination program. To date, we have received approximately 2,300 vaccines, and 1,405 of those are now into caregivers' arms. We're vaccinating anywhere between 100 and 200 people a day. We have 90 vaccines left, and we have been receiving vaccine resupplies just about every Monday of about 500, and I expect that to go up. At this point, as far as side effects to the vaccination, the vast majority of people are having some soreness in their shoulder in the site where they get the vaccine. That lasts for about a day or a day and a half. Some caregivers are experiencing some chills, muscle aches, headache. Some have expressed some mild nausea, but none of those side effects have been severe at all. As a precaution, if you have been exposed to coronavirus and had been diagnosed with coronavirus in the last 90 days, we are delaying your vaccine administration until that point in order to reduce the likelihood of a more severe sort of reaction when you get the vaccine. And that is supported by some of the experiences of other health systems around us who elected not to do that early on and have changed course.
Dr. Tucker, those side effects that you have just described, those aren't unusual, are they?
No, they're quite common. They're very similar to the side effects that patients might experience from receiving the flu vaccine every year. They are not indicative that you got an infection from the vaccine. They simply indicate that your immune system has recognized that something is there that shouldn't be and is taking action to prepare itself to defend your body against it. So it's actually a good sign. Most people can take care of these with some Tylenol or Motrin. I myself, when I received my vaccine 2.5 weeks ago, took some Motrin after because I was going to work for the rest of the day and I didn't want to feel draggy at all. So I actually felt very good that day and woke up the next day with a sore shoulder that really was not problematic for me at all.
Dr. Tucker, there's more than one vaccine. We've discussed how Adena has received the Moderna vaccine. We also know in the news there's a Pfizer vaccine. Will Adena be receiving any Pfizer vaccine that you know
To our knowledge, we will not be. The Pfizer vaccine came out a week before the Moderna vaccine, was also approved or authorized actually by the FDA a week prior to the Moderna vaccine. The Pfizer vaccine requires the ability to super cool the vaccine during storage. So you have to have a special freezer, which is not cheap. So that 10 facilities around the state of Ohio that possess that technology were the original recipients of the Pfizer vaccine. So at this point, we anticipate that we will be principally a Moderna vaccination location.
Understood. So our viewers might have questions regarding who might qualify to get the vaccine. So I'll ask Kathy a quick question. Kathy, what is the recommendation, or is the vaccine approved for children, or are those under 18?
So that's a great question. For the Pfizer vaccine, they did do the trials on 16 years and older. So for the Pfizer vaccine, yeah, someone that's 16 years and older could get it. But for the Moderna, it's 18 years and older. So there'll have to be more clinical trials before most children will be able to get the vaccine.
All right, thanks for that insight there, Kathy. Dr. Tucker, for a person deciding if they should get the Moderna or Pfizer vaccine, do you have a recommendation, or is it okay to get either one?
It's a great question. Both of them are in the 30 and 40,000 person trials, equally effective at preventing coronavirus infection. So that is very important. In folks that get this vaccine, and this is a 2-shot vaccine. So for the Moderna vaccine, you receive your first shot, then you wait 28 days and get the second follow-up shot. In folks who get both of those injections, it renders approximately 94% immunity to the likelihood of getting the virus. In my mind, more importantly, in the trial study subjects who received both injections, there was 0 mortality from the coronavirus. So this essentially eliminated the possibility that you would get the infection and die from it. And that is really principally one of the main goals of the vaccination strategy, is to stop people from dying from the infection.
Dr. Tucker, since they're both 2-shot vaccines, can you get 1 shot on your first dose and the other type of vaccine on the second dose?
That's a great question, Dr. Tucker. That is not recommended. They are recommending that if you get the Moderna vaccine first, that it is the one that follows, so that we should not be cross-vaccinating with the different brands, even though they both work with very similar technology, something called mRNA or messenger RNA as the base trigger for the immune response. They do not recommend crossing the shots over. So make sure you know which vaccine you get, whether you get it at the health department or a pharmacy eventually, and you'll be given a card from the CDC which will indicate which one you got, the date you got it, and the time that you are to return for your follow-up injection.
Dr. Tucker, has there been any instruction or any any advice when this does come out to the public? If they, for instance, get their first dose at CVS, can they go to another place and get the second dose? Or do you have any guidance there?
That's a good question. I don't know the specific answer to that one yet. I think what I'm seeing from the state, and now yesterday from the federal government, is a desire to remove as many barriers as possible out of the public's way at getting these vaccines into as many people as possible. A very kind of disturbing statistic I heard this morning, that was of all of the vaccines distributed across the United States in the last 3 or 4 weeks, 70% of them are still in refrigerators. That is a major problem. This has led to, as soon as yesterday, the Secretary of Health and Human Services recommending that we abandon this phased administration approach, where we say nursing home workers and residents, healthcare workers, they say throw that out the door, get these vaccines as efficiently and safely as you can into as many people that are willing to accept them. If that were the case, I can't imagine they will care whether you get it at CVS, Walgreens, or where you get the follow-up shot from, as long as it's a matched vaccine. Moderna for Moderna and Pfizer for Pfizer.
Dr. Tucker, we know that Adena has received doses for its own employees. When do you anticipate, or do you, Jeff alluded a little earlier in the program that we might be helping out to give those to the public. Any idea of when the public might be able to expect that?
Yeah, Mr. Graham and I are in regular sort of communication and group calls with the State Department of Health, the Ohio Hospital Association, the governor himself, in which we haven't gotten clear directive, but I believe that in the next week, it is possible that they will recommend advancing beyond healthcare workers and nursing home residents and workers to begin vaccinating people who are willing to receive the vaccine. I don't know if they will go as far as Secretary Azar has suggested and say just anyone come and get it who wants it, or whether they will move into 1B. So we're in 1A now. 1B will be where anybody 65 or over, or anybody with certain chronic diseases like heart or lung disease, liver disease will qualify. But regardless, I do believe in the next 7 days, we're going to hear a lot about the state's directive on administering this vaccine to the public.
And Jeff, from your perspective as the CEO of Adena Health System, do you believe that we'll have the resources, the energy, and the support to go out there and help the communities?
I do. I think. Well, I know all of the folks at Adena. You know, this is the one tool that we've got in this fight, and I do not expect to see anyone not willing to jump in and do the extra if it means pulling a shift of being able to vaccinate extras if we got a place open, if that's what we're called to do, and getting this vaccine out there, because that's what we do. That's what we do in taking care of our community. So no, I do not see any issue with resources as far as people willing to help. The other thing we got to watch is, you know, we didn't mention it, but, you know, we came out of Thanksgiving and we had a spike in COVID. And so when you talk about resources being available, you know, it took all of our resources with the spike after Thanksgiving. And, you know, we're expecting to see another spike now being from Christmas. You know, that's still to be determined on what that's going to look like. But as far as Adena playing its role and being able to give everything it's got to try to get the vaccine out there, absolutely. We're going to be a great partner.
Awesome. Thank you, Jeff. Dr. Tucker, we do have a couple of questions coming in from our viewers. The first one is, what percentage of Adena caregivers are being vaccinated?
As of this morning, we're sitting at approximately 40% of our roughly 3,800 employees or caregivers that have elected to get the vaccine. Now, mind you, one of our policies is that if you've had coronavirus infection confirmed recently, we hold that vaccine for 90 days after that to reduce the likelihood of a reaction. There are about 500 or so, 520 people who are currently on hold. So if you assume that a good fraction of those will consider getting it once they're outside their 90-day period, my hopes are that we will be sitting at roughly 60%, I'm going to say, in the next 6 weeks.
There's another question coming in, and this is for either Kathy or Dr. Tucker. When will signups for the community begin, and where should they register if Adena is going to be providing these? Any initial thoughts this early on?
Since I'm up on the screen, Kathy can chime to her. At this point, we don't have specifically questions about signups. I can tell you we started our vaccination program by having people scheduled to come get the vaccine. And when you're trying to do something on a mass scale like we are with this, I do believe it's better to kind of leave things a little bit more open than that. I'm not so sure that we will have the staff necessary to manage a very complicated schedule. I know that the alternative can be sort of chaotic, as we're seeing in Florida, where the governor's declared first come, first serve. We all see pictures on the news of long lines on the highway or senior citizens sleeping on the sidewalk. We certainly don't want that. But as soon as we have information on, number one, will we be designated as a public or community vaccination site, how the public will be able to access that if they wish to get it.
Yeah, and Jeff, could you chime in as well?
Yeah, I just want to clarify that we have not been given the direction, nor do we know that we will be a public site that will be vaccinating the community, to Dr. Tucker's point. So the last thing we want out there is that, Adena is going to be vaccinating the communities. We anticipate and we're willing to be that partner to take care of our communities. I just want to be very, very clear that Adena or any hospital or health system, have they been given the direction that that's going to happen? We just anticipate that. So I just want to make sure that we clarify that, because we're not currently registering or signing anybody up. There's no number to call. But as soon as we get that directive and we know that's going to be our part, they will be information like this we're giving right now. It'll be communicated everywhere on where we can get people signed up. But we're just not there yet. But to Dr. Tucker's point, it's going to happen within days. A week from now, we're probably going to know a lot. It'll be a lot different story, I believe. But I just want to clarify that.
That's a great clarification. So Adena nor any other health system is approved to do the vaccinations. But if I'm hearing correctly from you as a team, when we are asked, we will be ready and rapidly help the assistance for the community. So
yeah, we submitted the application that we were willing to be a public vaccination site. So we are willing and ready when the state is ready to supply us and give us the green light to begin.
Thank you. A couple more questions coming in regarding the vaccines from our viewers. The first one is, what about breastfeeding patients?
Yep. I make vaccine rounds daily to try to answer people's questions and help them if they have their doubts or concerns. I would say this is probably the most common question I'm getting, especially amongst younger caregivers, is the vaccine safety in pregnancy and with breastfeeding. So as it stands, the American College of Obstetrics and Gynecology has thrown in their support for vaccinating pregnant and breastfeeding mothers, that they believe it to be safe and that the benefits outweigh the risks. And that's generally how we think in medicine. The FDA has not granted approval for use in pregnant women or breastfeeding mothers. And that was because in the original 30 and 40,000 subject studies, they did not have a large enough number of pregnant and breastfeeding mothers to be able to say with statistical significance that there was no evidence of harm. So this ends up becoming a very personal decision for that individual as to whether or not they're going to be vaccinated if they're pregnant or breastfeeding. I can tell you that there was a nurse here in our emergency department and in our ICU, both of which were pregnant and elected to be vaccinated. Another one up on one of our floors who is elected to wait and watch and see. So that's a personal decision at this point in time.
Dr. Tucker, we have a couple of viewers asking about cancer patients. So if a patient has cancer or they're on specific medications, should they have concerns about getting the vaccine?
They should not. And again, this is sort of the same question about pregnancy. There weren't a lot of patients on being treated for cancer chemotherapy in these trials. This vaccine, however, is not a live virus or what we call an attenuated or a weakened virus. Some old vaccines were like that, and you had to be careful if you were immunocompromised, like on chemotherapy. This vaccine is not like that, so there is no chance you can get coronavirus infection from the coronavirus vaccine. Thus, generally speaking, it is safe to administer in people that are being treated for cancer.
Thank you. We really are getting a lot of interaction from our viewers. We appreciate that. So again, if you have questions or comments, please keep them coming in. Another viewer is asking, can they get this vaccine through their primary care provider?
At this point in time, no. One of the peculiar things about this vaccine is the extreme amount of regulation that has been placed on distribution and storage and use. So when we get flu vaccines, it's, they can go from fridge to location. There's no regulation that mandates anything specific about how you do that. This particular vaccine has to be received. It can only move one direction, meaning that once it comes from the state to the hospital or the vaccine location, it can't be moved again. It can't be taken back to another location or sent back to the state. Why? I have no idea. The second principle is the vaccine has to have the temperature recorded in the refrigerator where it's stored twice a day. Now, many of our refrigerators have the ability to monitor temperature inside and transmit that to a central monitoring unit, but many of our primary care offices do not have that ability. Do I think that in the next few months, it's possible that primary care offices will be getting supplies of the Moderna vaccine and administering it to eligible patients or willing patients? I do think that's possible. Although on the early out of the gate, my suspicion, if you wanted to make me guess, it's either going to be a local health department effort, like the county health department. Could very well be a pharmacy supported effort. And as Jeff mentioned, if the state engages us, we will set up vaccination sites for the public and community where you can come and be vaccinated.
Thank you, Dr. Tucker. Kathy, we started off the show talking about we've been through a holiday season and the challenges there. We do know that across the nation and in areas there have been surges and pockets of increased infection. Tell us a little bit about how your volumes have been over the holidays. How did you manage and how were patients cared for?
Yeah, we actually, saw a large surge following Thanksgiving. I think Jeff alluded to that. And the last couple weeks, it has gotten slightly better, a little bit more tapered off. And that's been a nice reprieve for our staff because, as you can imagine, they're tired. And when we talk about folks being tired, it's not just physical exhaustion. They're emotionally tired, mentally tired. It's very hard. And as you can imagine, we've had restrictions on visitation over the last several months, and a lot of the health systems have had to deal with that. And so not only are we caring for the patient physically, but they're used to having that comfort of their family at the bedside. So lots of shout out to our frontline staff for holding people's hands, sitting with them for long periods of time, and just being really that comfort to them. So we've been lucky, though, over the last couple of weeks to see somewhat of a little bit of a reprieve, just so folks can get some rest. But we do anticipate following the Christmas and the New Year's holiday that we're going to see some more increases in the COVID-19 patients.
It is amazing the work that your team under Dr. Tucker and Jeff's leadership as well, taking care of those patients through a difficult time. But I'm also impressed by your efforts to take care of the caregivers as well. And you've done a few unique things in the last several weeks to help our caregivers manage through that. Can you talk to us a little bit about some of the things like the wellness rooms and other initiatives that you and others in the health system have done?
Yes. So yeah, we developed some wellness rooms at all of our acute sites for our caregivers to take a break when they're at work. A place to kind of go to a silent area, lay in a massage chair, have a little reprieve because it's stressful. And what's so great is that these ideas, you want to give them what they need to feel better because that they're tired. These ideas came from them, things that they could think of that would really help them feel better when they're at work and have a break. The other thing we've done is we've had these days where we are providing meals to all of our staff, not just, a unit here or there, but to all the staff at Adena in order to just thank them and give back because they have given so much of themselves, not only for our patients, but for our health system and the whole community. So
has that been met with, what has been the reaction of
lots of smiling faces and so appreciative. Yeah.
Thank you for doing that, Kathy, and others. We definitely appreciate you. Jeff, when you're out in the community, being a leader in this community, or many communities actually, what are some of the things that you're hearing that are concerns that folks have, and how is Adena responding to some of those?
Yeah, I would start off by saying that the majority of the comments that I get is really community members saying to me, to the staff, thank you for being here. They tell me stories about their loved ones being here and what great care they received, and letting me know how much they appreciate that. And I can't tell you how much that means to the caregivers to hear that feedback. And so that's the big thing I'm hearing. But I get a lot of questions like what we're talking about today with, the vaccine and where are we at with the vaccine. But, the message hasn't changed. It's we got to be safe, and we got to continue to wear our mask. I'm in a room right now by myself. That's why I don't have a mask on. But when I walk outside of my office, I put the mask on. I touch that doorknob going out into the hallway, but I keep my hands away from my eyes, my mouth, my nose, and my ears, which is, something that's not easily done. You just do it out of habit. But it's washing your hands, constantly doing those things. Even though the vaccine's there, we still have to practice these safe protocols. So that's, the questions I get is also, is the vaccine going to take the mask away? It will help. It will help us get to that, that herd immunity where, we'll be able to get away from this. But we're a long ways yet from that. So that's been my message back and forth. Be safe, wear your mask, help us, help those caregivers that are on the front lines and have been working tirelessly day after day after day after day to help them get that break. But more importantly, to save a loved one. It might not affect you, but it might affect grandpa, or it might affect your mother. That could get infected, and there's nothing that predicts who will get really, really sick and who won't. So that's really been kind of the conversation that I've had with the community and the questions, but not really concerned. So I want to thank the community. To Kathy's point about visitation, it's been hard, and there's been some tough decisions made, but I really want to thank the community for understanding and working with us and understanding why we've had to have the restrictions there, which is for their safety, but also for the caregiver's safety.
A lot of things you're describing, Jeff, are going to help us to have a better 2021.
Oh, we are.
Despite the pandemic, you and your teams are active in looking forward. We have a lot of exciting things actually in the horizon, and I thought, at the beginning of the year here, it would be a great time to talk about some of those bright things that are on the horizon for 2021. So, Kathy, tell us a little bit about how Adena is being forward-thinking. What are some of the things that are going to be coming in 2021, and what do we have to look forward to?
Oh, we have so much to look forward to. I'm sure everyone's seen the structure out in the front here at Adena, and we've been working diligently on developing our Orthopedic and Spine Institute. And we've got IT systems that we're putting in place that are going to be fantastic for our patients and the whole community and our clinicians. We're moving to the Epic platform, and that's super exciting for the organization. It's going to be a great win for our patients and our clinicians. It pulls all of our medical records together. It gives a great view for our clinicians to give great care, but it also gives a great view for the patient to be able to see their care. So it's going to be really good.
That's fantastic. Jeff, you mentioned before also about Epic. One of the complaints that you heard a lot from the community when you first rejoined Adena was about our billing system, right? Is that a fair thing to say? And how will Epic kind of help through that as well? It's an EMR, electronic medical record. What would that do? How is that possible?
Yeah, so I heard it loud and clear about billing. And I heard it loud and clear about our emergency department. I can tell you today our emergency department is in a much different place than where it was years ago. It's a slow process. It's a animal. There's so many parts of it, and the biggest part of that is our medical platform and how the bills, the coding, all those pieces come together. And that's what's been so frustrating about not being able to just flip a switch. It's not that simple to fix it. Epic's going to be able to do that because currently our physician systems and the offices, the hospital systems, the cancer center, all those things they just don't talk to each other, and that's what Epic will provide. So that's going to take a lot of the era, if you will, of communications of those systems when it's just one platform. So I'm very excited about Epic. I'm very excited that it's going to allow us to get our billing to a place where it should be. And we're not the only ones that have this problem. I mean, it's across the healthcare industry, because you've got groups that are outside of Adena that provide services, and so you're getting multiple bills. And what we hope to do, and what we're focused on to do, is how do we tie that all in together? Because we want it simplified. I mean, even though we, like myself, I work at Adena, but I still get my health care at Adena, and I still get those multiple bills. So it's frustrating for me as from a patient, as I understand, I hear the comments from the community. But just know we have made improvements with what our current system is now, but we got a long ways to go. But Epic is going to be a solution. Kathy and her team have been working tirelessly to get the relationship in place and the contracts in place with Ohio State to be in that Community Connect, and they're kicking those things off. But still, it's not a month from now we have this plug and play electronic medical record. And Kathy can correct me, but it can be anywhere from 15 to 18 months before this thing gets up and starts to run. But I will say a couple other things that I'm really excited about. We've been talking about COVID, which is the primary focus of where people's minds are right now. But we are also very excited about other services that we are continuing to focus. So we're focused on COVID, but we also are focused on the healthcare needs beyond COVID. And so, there's things like our partnership with Nationwide Children. We just kicked off last week that Nationwide Children's hospitalist program is in our level 2 nursery. And so we have nationwide physicians inside Chillicothe campus, level 2 nursery, taking care of babies and working with our pediatric department. And then we also last year expanded when the Glatfelder Clinic at Woodlands, which was for the employees, Adena partnered in with Glatfelder and was able to pick up that office and the providers, and been very excited about clinic now is not just for Glatfelder, but it's for anyone that wants to come in. And we just very recently opened up a retail pharmacy at that location. So more access, that's what our focus is, our access and expansion into Pickaway County and Circleville. Urgent care there, this has been a tremendous success and gotten great feedback. We just recently expanded our service in Jackson from an after-hours clinic to an urgent care in that market. And there is just a lot of partnerships, a lot of opportunities we're focused on. And it's really about how do we keep that care close to home and the access. And we're listening to people in the region telling us, hey, what could we do to get this type of care here in our community? Or why do we have to drive a distance to get this type of care? And so that's why partnerships with Nationwide and other communities, Ohio State, not only in Epic, but doing the same thing with Ohio State, with medical care, medical services that maybe we would never provide, but they could bring it here, or partner with us and our physician specialties in expanding a service line here. So really the opportunities are unlimited in what we plan to do as a regional health system, not only here for Chillicothe, but across Southern Ohio.
Certainly a lot of things to look forward to in 2021 and beyond. Thank you for that great summary, Jeff. Dr. Tucker, Jeff, and Kathy, we have lots of questions coming in from our viewers. Dr. Tucker, we have questions around the vaccine. It's obviously on the top of mind of patients. The questions are all similar. I'll kind of summarize them here. Will diabetic patients be able to get the shot in phases? Will the vaccine work in people with autoimmune diseases? One of the health districts has formed an online register. Will they call them and administer the shot? Can the chronically ill get their shot? So lots of questions that I think that we don't have exactly the answers for. But I think if I heard you correctly, Dr. Tucker, when will we start to get some of those answers? And perhaps at our next Living Well in 2 weeks, we'll have some more specific information for patients. But any one of you, if you want to chime in about what you think this is going to go and how can patients get their answers around vaccines the best?
I think that the chronically ill will be prioritized. As a matter of fact, category 1B are those over 65 or those with chronic systemic diseases like diabetes, autoimmune disorders, etc. So yes, you guys are actually next in the lineup to go, and Jeff and I are anticipating possibly next week that being the rollout directive. Again, the state of Ohio, the State Department of Health controls the directive. It's not health system controlled, but we think that to be the case. As far as the Pike Health District, my assumption would be that they're generating lists of people who are willing to be vaccinated, and once they are given the go-ahead to vaccinate the public, that you will probably receive a call from the health department, date and time at which they want you to report for your vaccination. I don't know that to be a fact, but that would be my assumption, knowing how these programs generally work.
Thank you, Dr. Tucker. I want to personally thank the three of you, Dr. Tucker, for your clinical leadership to help us through the pandemic as well as this vaccine. Kathy, your expertise in just really operationalizing things and getting things to move quickly, you have just done a fantastic job. And Jeff, as president and CEO of the health system, thank you for being our communication both at federal and state levels, but also being that voice of comfort. I'm going to end with you, Jeff. What's some parting words would you have for our communities as we're entering in this new year and looking forward?
Yeah, so it's optimism. There's a light at the end of the tunnel. We're going to get to that light, I believe, in the first part of this year. The vaccine, continued focus, as I said, on safe distancing and masking, and it's being proactive, and that's what I would ask everybody to do. Continue, I'm like a broken record, continue to wear your mask, be safe, and the more we do that, the quicker we get to the other side of this, along with the help of the vaccine. And the parting words, I guess, would be just know that we're doing everything we can to be a partner and solution, working with the state government and providing possible solutions and how we can get that vaccine out there when and what I believe when will be called upon. But we're already thinking ahead, and how can we get shots in the arm, as the governor really is very focused on. So hang in there with us, more to come, and we're going to get to the other side.
Thank you very much, all three of you, for joining us. And more importantly, thank you to all of you out there watching us. We are appreciative of your time. We will hope that you stay safe and that you will join us again on Thursday, January 21st, for another episode, a community town hall, where we'll provide another important COVID-19 update, and likely and hopefully we'll have more information about vaccines. Thank you very much and have a good day.